Will Korea embrace the journey to telemedicine? That and more on Korea Technology Weekly. Hi, I'm your host, Dr. J.R. Reagan. In this episode, we'll be discussing South Korea's push towards telemedicine in an untact economy with less direct human interaction. The government announced that it would foster the non-face-to-face industry in the medical field as part of President Moon Jae-in's Korean New Deal plan announced in 2020. The Korean New Deal is a massive project with a total budget of 160 trillion Korean won, which is about 133.2 billion US dollars, and aims to create 1.9 million new jobs. Notably, the government plans to build a digital-based smart medical infrastructure to protect medical staff and patients in the healthcare field and improve patients' medical convenience. As part of the project, the government will build 18 digital-based smart hospitals that can monitor inpatients and consultation between medical institutions in real time through 5G and IoT, or Internet of Things. Starting with 3 hospitals this year, the government plans to add 6 more hospitals in 2022 and 9 new hospitals in 2025, while supporting 1 to 2 billion won per institution. According to the Korean government, the smart hospitals can transmit and manage image information of patients in quarantine and intensive care rooms in real time to medical staff, and help consultations between hospitals with infectious medicine specialists and hospitals without specialists. The project will also include dedicated respiratory clinics to prepare for infectious diseases such as coronavirus infections in the future. The government has decided to establish 1,000 dedicated respiratory clinics to identify and take action on respiratory and fever symptoms in advance. The dedicated respiratory clinics will be equipped with prevention facilities for infections, such as negative pressure facilities. They will implement a reservation system for face-to-face treatment after confirming the patient's symptoms through prior telephone consultation. The government plans to build 500 dedicated respiratory clinics in this year and open the remaining clinics by next year under the New Deal. Clinics will also receive 100 million Korean won per location for facility repair costs, imaging equipment, and sound pressure equipment purchases from the government. Besides the new facilities, the government will also develop Doctor Answer 2.0, artificial intelligence software that can diagnose up to 12 diseases, including liver disease, lung cancer, and diabetes. The government had previously invested 36.4 billion Korean won in developing Dr. Answer 1.0, an AI diagnostic software that can diagnose up to 8 diseases from 2018 to this year. The government also plans to establish a non-face-to-face medical platform through sufficient discussions with the medical community to respond to infectious diseases and improve public convenience. Specifically, it will provide a supplementary system for medical concerns such as patient safety, medical accident responsibility, and large hospitals. The medical charge of home health insurance using ICT will continue to expand from the government's earlier pilot projects. The government will first distribute IoT sensors and AI speakers to 120,000 vulnerable citizens, such as the elderly, to detect pulse, blood sugar, and activity while implementing digital care by supplying wearable devices to 200,000 people with chronic diseases, such as high blood pressure and diabetes. Compared with its peers around the world, Korea has been slow to adopt telemedicine. But the coronavirus pandemic has pushed the field into the limelight as people increasingly try to avoid physical contact. Telemedicine was first introduced on a trial basis in Korea in 2000, but the development of the field had been sluggish. People's rejection to visit hospitals following the pandemic outbreak, however, has made the authorities take a new look at the technology, with the goal to protect ill people and generate the growth of a new industry. The South Korean President Moon Jae-in emphasized the need to discover industries that could get attention following the coronavirus, including untact medical services. The South Korea Presidential Committee on the Fourth Industrial Revolution also recommended that the government reform its regulations on telemedicine to prepare for the likelihood that people will continue avoiding direct contact with others after the coronavirus outbreak is controlled. Since the coronavirus outbreak began spreading globally, telemedicine has seen explosive growth in countries around the world. According to a 2020 report from OECD, 26 of its 36 member countries have adopted telemedicine. Korea, on the other hand, has been slow to adopt telemedicine despite its reputation for top-tier medical professionals and facilities. However, protests from the medical industry, including from doctors running private hospitals, and political concerns that medical treatment could become privatized, led telemedicine to be bound by regulations since it began its first trials in 2000. Efforts to revise regulations on telemedicine in South Korea were made several times over the past years, but each of them has failed. Changes, though, have been prompted by the COVID pandemic. Recently, the Ministry of Health and Welfare announced it is temporarily allowing patients to receive consulting services or prescriptions from doctors over the phone. Remote monitoring was also permitted to allow people with little to no symptoms to get treated. But the Korean Medical Association has rejected requests to provide medical services over the phone, arguing it could add confusion since the system that supports medical treatment hasn't yet been established. But following the coronavirus outbreak, a dramatic increase in demand for the service has prompted a rapid expansion of the field. According to the ministry, 103,000 prescriptions have been filled at 3,000 medical facilities nationwide. Telemedicine technologies have come to provide contactless patient care and lab data reading, diagnosis, and even treatment. Smart hospitals, remote imaging, remote rehabilitation, and artificial intelligence or AI using medical devices is already available. Hospitals are even considering using telemedicine in nursing, disease prevention, and nutrition, which does not seem to be related completely to telemedicine but is worthy of investigation. Gearing up for future pandemics, South Korea seems to be leaning towards embracing telemedicine despite unrelenting protests from physicians, lobby groups, and civic activists. Introducing telemedicine services has long been contentious and a sensitive issue in South Korea, where the common good is the mantra of its medical system. Under the South Korea Medical Service Act, all public and private hospitals are categorized as not-for-profit and required to reinvest their earnings back into operations, not for shareholders or other investors. Establishing for-profit subsidiaries are also outlawed. Opponents of telemedicine have voiced worries about misdiagnoses, personal disease record leaks, and obstacles to early and timely treatment. The coronavirus pandemic, however, has clearly turned the tide. In response to soaring infections, the government temporarily waived a ban on remote services by medical centers nationwide last year. The results compiled so far are positive. More than 260,000 phone consultations and prescriptions were made at many institutions around the country, and among them were lots of small clinics. There has been no report of negative impact on the medical care system so far. What's being planned is a fresh concept different from that of conventional telemedicine sought by former governments in South Korea before the coronavirus pandemic. Overstretched health services and social distancing measures to combat COVID-19 are giving a boost to telemedicine, a phenomenon likely to continue even after the pandemic has been controlled. South Korea, with its world-class technology sector and low healthcare cost, is exploring digital health possibilities at a time when patients may need it the most. Korea has just begun the journey to telemedicine. That's all for this week's show. Follow me on Twitter or LinkedIn at Idea Explorer or my website ideaexplorer.com. Feel free to leave comments or suggestions about the show and tune in next week for more news and trends about Korea technology.